Do you get nagging upper back pain that won't go away? Hi, I'm Dr. Dave Candy, and in this video, I'm going to show you 7 upper back pain stretches to help relieve the pain fast, but also keep it from coming back in the future. Now, there are a lot of different things that can cause upper back pain, but rather than bore you with a long introduction, I'm just going to jump right into the exercises, and as we're going along, I'll explain what type of upper back pain each exercise is good for. Now, this is actually a format that I got from reading viewer comments, so if you like this format, leave a comment so that I can make more of the type of videos that you like to watch. So let's get started. The first exercise is a wall slide. And to do this exercise, you'll stand facing a wall with your forearms on the wall. Then you want to put a little bit of pressure into the wall with your forearms, and then slide your forearms up the wall as high as you can. Hold that position for 10 seconds, and then slide back down. Now, if you're not wearing long sleeves, it helps to use a towel so that your arms can slide a little easier on the wall. So again, push in, slide your arms up, hold that top position for about 10 seconds, and then slide back down, and then repeat 5 to 10 times. So slide up, and then slide back down. Now, what type of upper back pain is that good for? Well, that stretch is particularly good for people who have upper back pain due to one or both shoulder blades being down too low. You may notice that looking in the mirror if you notice that one shoulder blade hangs down lower than the other, or if you notice a sharp downward slope on your neck, you may have depressed shoulder blades on both sides. You may also notice that if your collarbones go straight across and they don't angle upwards slightly, that's another indication that you may have one or both shoulder blades that are depressed or lower than they should be. Now, normally your shoulder blades should sit between the 2nd and the 7th thoracic vertebrae. But if they're down lower than that, then they pull tension on your neck muscles, and that in turn compresses the vertebrae in your neck, and that can pinch on the nerves that come out of your neck. Now, the nerves from your lower neck, particularly the C5, C6, C7, and C8 nerves, can actually refer pain down into the upper back. And neck problems are one of the most common causes of upper back pain. So by doing that wall slide exercise, you raise your shoulder blades up, you unload the neck muscles and decompress the nerves in the neck. Additionally, some of those nerves, the C5, 6, and 7 nerves, form a nerve that runs down underneath your shoulder blades, called the long thoracic nerve. And that nerve innervates a muscle called the serratus anterior that runs from your rib cage underneath your shoulder blades, and that itself can actually cause upper back pain. Now, interestingly, that's the muscle that you use when you do that wall slide exercise. Another benefit of the wall slide is that it stretches out the rhomboid muscles, the muscles between your shoulder blades and your spine. And so for that reason, that's my #1 pick. Whenever I hear people who have upper back pain, that's probably the most common exercise that helps most people. Now, the second exercise is another version of that, but this one's more for people who have one shoulder blade that's lower than the other. That may be because your dominant side just hangs down a little bit lower because of having more muscle on that side, or it may be because you have a scoliosis or a curve in your spine that makes you a little bit crooked and makes one shoulder down lower than the other. But for this exercise, you're going to do that same reaching up in the air, but you're just going to do it with one arm. So you reach up as high as you can go, and then go slightly over the top. So this is mostly an upward movement, and then a little bit of side bend. And that helps correct a muscle imbalance. So you stretch out things that have gotten too stiff on this side from that side being lower. So because things are already imbalanced and you're stretching to correct that imbalance, this is one exercise that you should probably just do on one side. So only do it on the side of the shoulder that's lower. And if that feels better, then that may be a good exercise to help you relieve your upper back pain. Now, the third exercise is a thoracic flexion exercise, an exercise where you bend your thoracic spine forwards. Now, a lot of people that you read about on the internet, or if you talk to physical therapists, a lot of times people focus on chest up, pulling the shoulders back. And that's good to an extent, but you're supposed to have a little bit of rounding or curve, or the medical term is kyphosis in your upper back. That's the way the upper back is normally supposed to curve. And people who focus on having too straight a posture or too good of posture can actually start to develop pain from having too little kyphosis in their upper back. And so this exercise is good for people who have a really flat upper back or who have shoulder blades that are pulled really far back. It's common in military people because of the posture that they're taught to stand in, or also people who their parents just always nagged them about slouching and they got a little too vigorous with it and overdid it. So for this exercise, you're actually going to round out your shoulder blades a little bit or stretch forwards like that. And this exercise also helps stretch out the rhomboid muscles, but it restores a little bit of that kyphosis or that normal amount of rounding that you should have in your upper back. And again, it's not to say that you should slouch over like this, but neither too much of this nor too little is good. So you want to find a happy medium. Now, another version of this that works really well to get a deeper stretch is if you hang on a piece of furniture, a sturdy piece of furniture, not something that's going to tip over like this chair, and hang back and stretch. And even on this, you can feel a little bit of a stretch, but hanging onto a couch or a desk or a piece of exercise equipment or a doorknob are all great ways to help unload your thoracic spine. And on something sturdy, you can really kind of lean back into it and stretch out your upper back into flexion, as well as stretch out the rhomboid muscles that sit between your shoulder blades. So that's the third exercise. Now, the fourth exercise is actually going to be for twisting or rotation of your upper back. This is really important for people who play sports like golf or tennis or pickleball, where you have to twist or rotate a lot. But it's also important just for normal walking gait, where you swing your arms back and forth. In fact, people with Parkinson's or Parkinsonian type gait tend to lose that and they walk really stiff. So having good amounts of rotation or twisting in your upper back is important. That also helps prevent you from twisting too much at your lower back, which can then create lower back pain. So to do this exercise, you'll sit in a chair and run one arm kind of in the direction of elbow towards the opposite knee. And go as far as you can comfortably, and then hold that position for about 10 seconds. And then come back up and go the opposite direction. Now, if you happen to notice that one side is particularly more difficult than the other, then this is probably an exercise that you would benefit from doing. It's still probably a good idea to do this on both sides though, because doing the good side actually can help free up the more restricted side. So going back and forth about 5 times each way. And you should notice as you go through the progressive repetitions that you're able to get just slightly farther each time. Now, a point with all of these exercises is don't push through pain. So only go as far as you can comfortably with this exercise or any of the other exercises. Now, the next exercise is a good exercise for pain relief. It's also really good for people who do have a little bit too much slouching of their spine, but it feels good for just about anyone. Now, to do this, you do need to be able to get on the floor. You also happen to need a foam roller. So if you don't have one of these, I'll put a link to this in the comments below. But you put the foam roller on the floor and then sit down on the floor. Put the foam roller underneath your back and then cross your arms across your chest tightly to get your shoulder blades spread out of the way of your upper back, or you can also put them behind your neck like this. But put your arms across your chest, and you will a lot of times hear or feel little pops doing this. I felt one just getting set up. But roll back and forth over the foam roller. And this is like a nice little massage for the muscles in your upper back. It can also help mobilize or pop joints in your upper back, which a lot of times feels pretty good. Now, if this is painful for you to do, which it may be either if you have a really flat upper back, or on the other extreme, if you have a really stiff, rounded upper back and the bones have kind of started to fuse together, that may not feel comfortable for you. So if you try it and it doesn't feel good, just skip it. It's probably not the best exercise for you. But for a lot of people, that is a really comfortable exercise and a way to relieve thoracic pain pretty quickly. Now, while you're on the floor, you can do another 2 exercises here. And if you can't get on the floor, or if it hurts too much to kneel on the floor, you can also do these 2 on a bed. But get in an all fours position like this. And this is going to have similar benefits to the wall slide exercise as well as the thoracic flexion exercise. So you're going to tuck your chin down towards your chest and then push the floor away from you so that it rounds your upper back. It's sometimes called the angry cat. It's part of the cat camel or cat cow pose, but for this particular exercise, just focus on pushing your upper back up and rounding out your upper back. So it gets a little bit of thoracic flexion. It stretches the rhomboid muscles between your shoulder blades, and it also activates your serratus anterior muscles. Now you can make this a little bit more like the wall slide by pushing yourself backwards with your arms, but maintaining that downward pressure into the floor. And then coming back, press up, hold that top position, and then start to press backwards. And so that activates your serratus anterior, stretches the rhomboids, and rounds out your upper back a little bit. And again, that's for similar benefits of the wall slide exercise as well as the thoracic flexion. So if you have one shoulder blade that's lower than the other, or if you have an upper back that is too flat. Now the last exercise is a version of the seated thoracic rotation stretch. And for this one, you're just going to bring one arm underneath of you in the direction of the opposite knee, just like before. And then bring the other one under you. And just alternate back and forth. Now you may wonder, what's the benefit of doing those last 2 exercises if they simulate ones that we already did earlier? Well, there's really not a huge benefit. And for most people, just doing 1 or 2 of these exercises is probably going to give you the biggest bang for your buck. So you don't have to do them all. And for most people, it's not even beneficial to do them all. So give them all a try, see which 1 or 2 work best for you, and then use the ones that seem to help you relieve your pain the most, especially if you happen to have a lower shoulder blade or a back that's too flat or a back that's too rounded. You'll find ones that are better for you and not as good for you. Now, let me know below in the comments which ones you found that worked for you. I'd love to hear the feedback. And if you happen to be in the St. Louis area and need more help for upper back pain, then we'd be happy to help you out here at More for Life. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.